say something, you say no.
All right, welcome back. You're still watching News Up. It's now time to talk mental health. We have with us in the studio Dr. Nayah Egegbara, and we'll be looking at the issue of anxiety disorder in our society today. Disorders, actually. So, Dr. Nayah, when you hear about anxiety disorder, a lot of people might find it difficult to understand what exactly it means. Tell us what exactly that means in terms of mental health issues.
Okay, anxiety disorder is actually one of the more commonly occurring mental health disorders. It's quite common, more common than most people may appreciate. And the core of the disorder is that there is an overwhelming fear or worry about a particular situation. Sometimes that situation is specific. It can be identified. Sometimes it's just overwhelming fear about everyday activities. And with that fear then comes some bodily responses such as awareness of the heartbeat. The individual feels that, you know, the heart is racing. And if you do take the blood pressure, for instance, at that time, you find that it to be raised. Then there's chest tightness, the person feels they are choking. There could also be other abdominal symptoms. Then feelings of fainting, you know, as if they are losing control. So, and it can actually interfere with daily functioning. So the person is not able to carry out their regular, normal daily activities because of the disorder. But I need to distinguish that it's actually normal to have some anxiety over certain situations, especially if you're in an unfamiliar situation. But it's normal only if it lasts for a brief length of time and you're able to control yourself over the situation. But it becomes a disorder when the symptoms are enduring and they begin to interfere with the person's normal functioning.
Are there different types of anxiety disorders, or is it just one type that every other person also has?
There are various types. Okay. Actually, anxiety disorders are a part of a group of disorders classed as anxiety and stress-related disorders. But specific anxiety disorders are quite a few. There could be the generalized anxiety disorder, then there could be the specific anxiety disorders, which means that the fear, the anxiety, the worry is associated with a particular precipitant. Yeah. So the difference is with the generalized anxiety disorder, the symptoms I explained earlier are provoked by general events of the day. And it could be one thing today and another thing tomorrow. So there may be no one isolated precipitant for the onset of the anxiety symptoms. But when it's specific, such as social phobias, agoraphobias, you know, it's when that individual is exposed to a specific situation. For example, social phobias, you know, they develop the anxiety symptoms when they have to interact with a number of people. So the fear of humiliation in a public place causes that anxiety. And agoraphobia is when they're afraid of being in crowded places, and the core of that fear is really that they are thinking that escape from that place may be difficult. So that provokes anxiety. And then those symptoms I talked about then start manifesting: trembling, feeling faint, then the symptoms where the heart is racing and difficulty in breathing.
Do we have statistics as to how bad this is in Nigeria?
In Nigeria, the statistics are not really well known, but it affects females twice as more as much as males. So, but in a place like the US, it's been noted that up to 19 million citizens of the US actually have some form of anxiety at some point in their lives.
So is agoraphobia the most prevalent kind of
Yes, it's one of the common types.
ones, okay.
Yes, of specific anxiety disorder. It's one of the common ones.
So how can we deal with this, with kind of anxieties? Because on a daily basis, we're exposed to different things. We're anxious about different things. I'm anxious about what I'll eat for breakfast, for example. I'm anxious about the weather, if it rains, the traffic I'm going to face. I'm anxious about the health of maybe my loved ones and all of that.
About the state of your bank account.
That's right again. So how can we deal with it?
Seriously, I mean, there are a series of issues that could create anxiety in Nigeria.
So, and then there has to be a clear-cut distinction between the body's normal response to normal anxiety-provoking situations, and then when the response to that particular situation has become overrated. So, it's normal to briefly be concerned that maybe it could rain today and you're not sure you're with an umbrella, but that doesn't stop you from going out. If you need to be somewhere, you will still go, and you will hope that the rain does not beat you along the way. If it's issues about finance, for example, you will still go out there and try to do something that will make sure that you're not in that state where you're now deprived financially. But persons with anxiety disorders, their perceived fear and the anxiety it provokes is out of proportion with the real situation. Okay, so the person who, for example, the simple example you gave about the fear of whether it would rain, the person would rather not go out. So it begins to affect the person's daily functioning.
Let me give you this example. We just talked about non-remittance of pension by some state and federal government and even some private business owners. Now, they haven't been paid their pension and they rely on the pension because that's the only means of survival anyway. Now, we're already in a new month and they haven't been paid for June, for example. They might be thinking of how to take care of their health, what to eat and all of that. What kind of anxiety is that, and how can they deal with it, because it's not within their powers?
Yes, it could actually cause generalized anxiety disorder because, need for anxiety disorder, because need for financial comfort covers so many areas of one's life. So they could become afraid of falling ill, they could become afraid of
begging for food,
where the next meal will be. So there won't be just one specific thing that could provoke the anxiety. They begin to worry about various things that they could have solved if they had that money. So yes, it could actually precipitate anxiety disorder in such persons.
How harmful could this be?
Oh, of course, when somebody is not able to carry out their daily activities, it could be quite harmful. So it requires treatment, and there are professionals who can help people. It's actually a disorder that is treatable. It's one of the treatable disorders, but persons need to first of all identify that there is a problem and then seek help in the right place. A few tips of how to solve the issues, even in day-to-day anxiety-provoking situations, could just be practicing what is called mindfulness. Mindfulness. Okay. Mindfulness is just a word to explain, you sort of consciously taking control of where your thoughts are at. Okay, so you're at work now, you just focus on the present and not worry about what will happen after now. Okay, so because the tendency for those who have anxiety disorder is that their thoughts are all over the place, and so as they continue to dwell on those negative thoughts, it continues to get magnified, and so the symptoms then begin to manifest. Then breathing exercises are quite helpful. Okay, so for example, somebody really doesn't like heights, and the person has to go on the lift to get to the 12th floor of a building. Okay, so one who really has a disorder with heights would rather take the stairs. But it's a normal thing to actually have a little bit of anxiety. You may wonder, what if, like in Nigeria, what if the power supply goes off and you're stuck there? So, but if at that moment you can just practice some breathing exercises, which helps to increase the carbon dioxide level in the body, it helps the individual to relax. Okay, so, but of course there are also medications, there are also some other psychological treatments, like desensitization.
What does that mean?
It's just a word to explain part of the process in getting the person to relax in the face of the threat. So the mind already has been sensitized against a particular situation. Is a treatment modality that works best when one can identify a specific precipitant for the phobia. So let's say...
You used the word phobia. I was going to ask you before you used that word, what's the difference between phobia and anxiety disorder?
Phobia is the fear that brings about the anxiety. So phobia is just another word for fear. So that feared condition, you then try to desensitize the individual by exposing the individual to that situation in various ways. It could be systematically in graded portions until the person then gets comfortable with the situation such that it doesn't provoke anxiety anymore. But this has to be under the guidance of a professional, okay, so that the person is able to be guided. The body then can be regulated not to begin to produce certain hormones. That the body does produce certain hormones in response to these anxiety symptoms, and that is why you have those other symptoms like the heart racing, difficulty in breathing, and all the tension and all the trembling that is associated with anxiety disorders.
Now this sounds really easy, right? But I want to know how realistic it is. When we talk about this mental health or mental illnesses, the most common, or what we talk about most often, is the depression angle of it. Now, I'm looking at cases of students who have to write examinations. They're anxious about writing examinations. They're not sure of passing. They want to pass. They don't want to carry over. Whether it's specific, I think this one might be specific because it's an examination they are facing. You said breathe in, you know, take a deep breath, try to distract your mind from whatever that is. But in the case of students who are facing examinations, how can they distract? How can breathing in help them?
It's not all anxiety-provoking situations that actually cause negative effects.
Okay.
Okay, so fine, one has an exam in a month down the line. Naturally, one would be concerned or have a little bit of anxiety about what the outcome may be. And naturally, that should stimulate the person to then read. And that would help to bring out the best in that individual concerning that exam. Okay, so that's why I said it's not all, a lot of the experiences of anxiety could actually be within the normal context, because a person is then able to still take logical actions regarding the situation that is causing that anxiety. So, but it becomes a problem if the fear is so overwhelming and the symptoms of anxiety have set in, and then the person begins to avoid the situation that has caused that anxiety, then there is a problem. So a student, for example, who has an issued anxiety disorder will create a reason not to write their exam. So that is an abnormal response, and it will require treatment to help that individual tackle that issue.
So like a friend of mine who will squeeze me in the airplane, and just as the plane takes off, he squeezes me so hard, and he's like, he stops breathing for a second. How can I help him?
Tell them to just relax. Aerophobia is actually a very common form of anxiety. A lot of people have it. Yeah. So, but it may not be debilitating to that your friend because he's still able to get on the plane. Okay, so
he's responded positively to it.
Yes, he's able to still take on that challenge, knowing that he will not die, he will not faint. Because what makes people avoid it is that they now fear the worst, so they avoid that situation completely. So if you've got a friend like that who is on the plane, he could just cup his hand over his mouth and begin to breathe. So the essence is to breathe in a lot of carbon dioxide as well, because that helps the body to relax.
All right. Dr. Nayah Egegbara, consultant psychiatrist, thank you for your time with us on this mental health awareness series. This is the third or fourth in the series, and we'll keep talking about this mental health awareness until Nigerians know the importance of having mental health, to be mentally alert, to visit the psychologist or psychiatrist to ensure that we are mentally healthy. It's not a crime to mentally ill. We just need some, a way forward to ensure that we are well. Just like malaria, we treat malaria, we should also treat our health mentally. Thank you so much once again, Dr. Nayah Egegbara. And that's what we'll call it today on the show today, David.
Yes.
It was a long day, a short time. Time flies while we're having a good time.
Yeah.
But fortunately, there's another day tomorrow.
So we'll see you again tomorrow. We'll do this again tomorrow. To have yourself a beautiful business day.
Bye.
Bye for now.
You say something, you say no.